patients, low risk, and to the bicuspid. And there actually they found in the bicuspid group, using various valves, high event rate compared to surgery. So they compare the TAVI with the surgery, so overall, still little benefit in the surgery, but clear cut. In the bicuspid, the surgery was superior. So what basically message from the Notion 2 trial is that low risk, young age, bicuspid, higher stroke rate with a TAVI, and those patients should preferably go for surgery unless there's some life other reason, and that is usually could be the hostile mediastinum. They had a radiation in young age, surgeons don't want to do it. Very calcific aorta or something. We had to be compelled to do those bicuspid cases because short term may be okay. Within couple of years, you will start seeing the curve diverging for the TAVI versus surgery. And we don't want to test, which we already have a hint now from the Notion 2, because every trial in the United States of the bicuspid, we use the selected cases as a bicuspid arm only. But those were the cases did not have hostile mediastinum, and the bicuspid type 0 and low risk were done. But those were only single. First randomized trial, part of the Notion 2, bicuspid is the bad news. So therefore, those cases should go for surgery, not for the TAVI. And I'll ask Hassan to comment on that.
Yeah, Notion 2 is a very interesting study, as Dr. Sharma said, but actually in Cedars-Sinai we don't believe that study because it's always in small print. So when you look at the supplement, you can understand so in fact they included type 2 bicuspid, which almost never we consider suitable for TAVI. Also they are using they use accurate valve, and they use portico valve, which both have a lower radial force. And some of the complications, because the other factor is very underpowered study. So although they looked at bicuspid, they only looked at 100 patients. So Dr. Makar published from TBT registry bicuspid several thousand patients, and although carefully selected, we need to know the right kind of bicuspid, as Dr. Sharma is saying. We believe that you can do in bicuspid, even in younger patients. So we're doing typically with Dr. Makar patients in 40s and 50s, but usually these are anatomically very good cases. So not the cases with heavy calcification or asymmetric, but cases that have very good anatomy.
So I think basically, 45 bicuspid valve patient, why do you want to do it? Just because you want to show off? So that's not the right thing, right? It is making what is the patient. Patient might come and say, oh, I don't want surgery. Really? I can convince anybody for surgery, I feel like. So I think you better try to convince the patient for surgery at 45. If not, you will be getting surgery at 55, right?
I'm very, my mentor is very pro-intervention, so I feel very, so I'm 48 years old. I have 3 small daughters, and I don't want to take the risk of, so if my anatomy is good for TAVI, why not have the TAVI? It's same like the debate for left main many years ago. It's the same. If your anatomy is good for left main intervention and your syntax score is low, why not have...
So, exactly, I'll give you the option. So, your risk of surgery is less than 1% now. Or, we'll do TAVI now, and at 55 or 58, your risk of surgery with TAVI explant is going to be maybe 5%. Which one would you accept? So, that's what actually it is. Because I can't tell you you are going to get a TAVI now and you live forever, right? I have to tell you that most of the people now, we have explanted 4 TAVIs last month, and all of them are actually, 2 of them are in low risk trial, where the valve lasted only 7 years. And 2 valves failed in 2 years. So you have to be cautious and explain all of these with the patient.
But after 10 years, you may have much more better technology to do TAV and TAV or something like that.
you can't bet on the future always, right? The future has been shown that we made lots of mistakes as well, you know, and our past has shown that we have made lots of mistakes by trusting that the future is going to be much different. Any other questions?
I'm Dr. Vivek from Bangalore. See, in Indian population, we have small frame personalities.